Every 7 minutes in 2021, someone in the United States died of an opioid overdose. And in a 2018 Pew Research study, 83% of respondents said that opioid addiction was a problem in their community. Now, I could stand up here and rattle off a lot of other very depressing statistics, but that's not the reason why I'm here today. I am here today to give a message of hope and to equip everyone in this room with practical tools that you can use in your everyday lives to promote recovery-friendly communities. The problem of the opioid epidemic seems insurmountable, but it doesn't have to stay that way. But before I do that, let's go over a brief overview of addiction and recovery. So addiction, in addition to being a chronic illness that affects millions of people worldwide, is a disease of isolation. And as someone progresses farther in their disease, they become further and further isolated from friends, family, and loved ones. Additionally, the families of those who suffer from OUD, opioid use disorder, which is also known as OUD, also feel isolated as they feel shame and stigma around the fact that they're searching for help for their loved ones. And this contributes to an overall feeling of helplessness among those who suffer from OUD and their families. Addiction cannot be cured, but it can be managed. And people go into recovery every day. Notice how I say go into recovery and that they're not treated or rehabilitated. That's by design. Treatment is a one-time event with a beginning and an end. Recovery is a long-term commitment to a healthy way of life free of use of opioids and other substances. By building recovery-friendly communities, we can do our part to remove barriers that exist for people getting the help that they need. And we'll do that in two ways. The first way is reducing stigma about opioid addiction. And the second is building community resources and public support. The benefits of building recovery-friendly communities are sizable. There are 3 million people that are estimated in the United States who suffer from OUD today. That's 3 million people who don't need to become a statistic or a headline. Those are 3 million people, some of which I'm sure are known by individuals in this room, who still have a chance to recover. Additionally, if you need a financial motivation, the opioid epidemic is estimated to cost $93 billion in lost productivity every year. It also costs the healthcare system about $37 billion. And studies show that for every dollar that is spent on addiction recovery resources, there is a $4 to $7 decrease in drug-related crime, drug-related theft, and drug-related criminal justice. Seems like a pretty good return on investment to me. Now first, we're going to talk about stigma in the addiction space. So stigma is defined as a targeted discrimination against a group of people, a place, or a nation. So specific to those who suffer from OUD, this is the unfounded belief that people who suffer from OUD are dangerous, incapable of managing their own treatment, or that they're at fault for where they are. And stigma in the opioid addiction space stems from the incorrect belief that addiction is a moral failing on the individual who suffers from it, that they made a bad choice and this is their punishment for doing that. But we all know that that's not always the case. In fact, it's rarely the case. People can get addicted for a number of reasons. Now, stigma has a number of negative effects that are measurable and impactful. The first negative effect is shown in a study that was conducted on young adults who were seeking medication-assisted treatment. They were asked, what are the barriers that prevented you from getting a treatment? And the answer that was given is that stigma and shame and judgment were the number one reason that they didn't seek treatment. So think of this. You have a young adult that knows they have a problem, that knows they need help, and they won't get that help because they're afraid of what people might think. Additionally, another study showed that healthcare providers that held negative stigma about people with OUD provided worse health outcomes than people who didn't have negative stigma about OUD when treating patients with OUD. And when we use language like a drug addict, a druggie, a junkie, even referring to people who have recovered as a former addict, that dehumanizes the person because it makes their addiction who they are. As a healthy alternative, we can use person-first language. So, for example, it's a person who suffers from OUD, or a person who is in recovery, because it's somebody who has or had a problem. It's not somebody who is the problem. And especially since there's so much stigma and so much fear in the space, this is important to make sure that people feel safe coming out and talking about the problem that they have. Picture this. You get a call, ring, ring, it's your doctor. They're calling with your COVID-19 PCR test results, and they say, your test is dirty, you're dirty, go into quarantine. Think of how you'd feel with that. But routinely, when we talk about drug test results, we talk about them as dirty or clean, when clinically, they're positive or negative. And when we refer to people as using or not using. And vocabulary is hard. Even when I was writing this talk, I had to reread dozens of times to make sure that I wasn't perpetuating stigma and that I wasn't contributing to the problem, and that I'm part of the solution. Now, in addition to language, another piece of this is education. There is a lot of misinformation that's out there about addiction and recovery. And I don't have unlimited time, so I'm going to talk through 3 myths and what the truth is behind them. So myth number 1, addiction is all in your head, and if you will hard enough, it will all go away. This is false. OUD rewires the reward center of your brain so that the only thing that matters in life is procurement and use of opioids at great personal cost. And if you ask anybody who has suffered from OUD, I guarantee none of them wanted to be addicted. Nobody wakes up and says, I want to be addicted to opioids today. Their brain will not let them stop without some sort of outside help. Myth number 2, only people who are addicted to opioids have overdoses. This is also wrong. Anybody who takes an opioid, legal or not, prescription or not prescription, can potentially suffer an overdose. Some individuals are at higher risk, but they're not the people that you'd think. People with COPD or sleep apnea are at a higher risk of overdose. People who have high doses of opioid prescriptions for legitimate reasons, for legitimate conditions like cancer or major injuries, are also at risk. Young children and young adults who experiment with illegal drugs or club drugs are at risk. Or people who genuinely misinterpret their medication instructions are at risk. There is no stereotypical person who suffers from an opioid overdose. It can happen to literally anybody. And the third myth is that there's only one way to recover, and that's going cold turkey. Just lock them in a closet, don't give them the opioids. That is also incorrect. The only consensus in the medical community when it comes to recovery is that there is no consensus. Everyone's path to recovery is different. Sometimes it includes medication. Sometimes it includes inpatient visits or going to a rehab center. Sometimes it includes going to an NA, meetings that end in A. And sometimes it includes peer support, or all the above, or none of the above. Sometimes they try it multiple times before they succeed. But everyone's path to recovery is different, and there is no right or wrong answer. So we've talked about vocabulary and education. Now I need you to use it. So you'll find that many people out there are simply misinformed about what the facts are and aren't in the opioid addiction space. And you'll find people are surprisingly receptive to learning something new. Because so many people have been impacted by this issue, chances are they know somebody who suffers from it and can relate. Now, the second thing is building community resources and public support. Now, if you've talked to anyone who's either suffered from OUD or have a family member who has suffered from OUD, you'll find that it's anything but easy, even once the person decides they want to go into recovery. Navigating the system is hard. There's tons of different options, tons of different opinions, and I'll remind you that these are people who feel stigma and shame and don't want to ask for help. Now, how do we solve this? Well, an often underutilized resource that exists is called Recovery Community Organizations, or RCOs. So RCOs are independent, nonprofit, recovery community-led organizations whose sole existence is to create safe spaces for people to recover regardless of where they are in their journey. So if somebody's not ready to go into recovery yet, it's focused on harm reduction. Let's prevent any future damage from being done. If they're ready to go into recovery, there's a number of different options. RCOs do this in two key ways. The first is through public advocacy work. So it's getting on a stage like this and talking about the facts. The second way is through peer support and referral resources. So helping people get to that first step that they need. And studies show that RCOs are extremely effective at reaching out to the most vulnerable members of our community. We're talking people who are unhoused, people who inject drugs, and people who are in drug court. These are individuals that are very effectively reached out to by RCOs. Now, you might ask yourself, why don't I have an RCO in my community? Or how do I get an RCO in my community? The answer to that question is, you have to ask. So there are only 140 RCOs across the entire United States. And when they were asked, why aren't there more RCOs and why don't you expand services, 82% of them said funding, not surprising in the nonprofit space, but more surprisingly, 63% of them said community engagement and stakeholder support. That means people in this room, local, state, federal representatives, they have to want it. So unless we ask for this, it's not going to materialize. People don't create services that people don't ask for. And if you think about it, there's money raining down everywhere that's dedicated to the recovery and addiction space that's designated to solve these problems. Some of it courtesy of some of the settlements recently with the opioid manufacturers. But oftentimes that funding stops at the state level. And if they don't have a better use for it, chances are much of it is going to end up in law enforcement, which is not a long-term solution to the opioid epidemic. So unless we advocate for these things, so talk to your local, state, federal representatives and say that this is something we want and support the ones that exist, they will not materialize otherwise. Another simple resource we can offer in our communities to prevent overdose deaths is naloxone. So naloxone, that goes by the brand name Narcan, is an overdose reversal drug that works in a matter of minutes, highly effective, highly portable. I have an example with me today. Looks like this. Just one spray up the nose is all it takes. And you might think, all right, this is a pharmaceutical product that's really effective and really convenient. It must be really expensive. And normally you'd be right. But I have two fun facts for you in the state of Wisconsin. So fun fact number one, did you know that the state of Wisconsin has a standing order that allows anybody to get naloxone without a prescription, and it's covered under some commercial insurance? Sounds great, but I'll do you one better. There actually is something called the Narcan Direct program in the state of Wisconsin, where certain organizations that sign up can get Narcan free of charge, and all you have to do is ask for it. So, if we have naloxone, this overdose reversing drug, available free of charge as much as we want, why is there a single overdose death in Wisconsin? And the problem is distribution. So naloxone does not do any good sitting in a school nurse's closet, in a healthcare provider's office, or with an EMT. They would probably have it anyways. In order to solve the problem of opioid overdose deaths, we need to get naloxone in the hands of people who need it, where they are. That means we can't be afraid to put this in public spaces, like libraries, like schools, both elementary, high school, colleges, the bus station. Wherever people are, there should be naloxone available for people to access for themselves or for someone they know, or as a precautionary measure. Everyone should have some. Otherwise, if you see someone overdosing, how can you do anything? It's a simple resource that's low cost, and really there's very little downside to it. And people need to be able to access naloxone without feeling stigma or shame while doing it. And if you have naloxone available, picture this. Picture how many AED machines you walk past on a daily basis, and imagine if there's a box next to all of them that has naloxone in it. Then people wouldn't feel stigma because they're everywhere. So we've talked about a few things today. We've talked about building recovery-friendly communities by destigmatizing opioid addiction and through education and dispelling misinformation. We've also talked about building community resources and support through creation, support, and advocacy of RCOs and through naloxone access. Now I need you to go out and use it. So if these things all seem like very simple, very ground-level things, and you're 100% right in thinking that. If this was an issue that could be solved from the top down, where we throw a bunch of money at it and problem solved, that would have already happened. But here we are years later when we acknowledge that this was a pandemic, or an epidemic, and not much has happened. This is a movement that needs to start on the ground level, and it will be block by block. And we need to create recovery-friendly communities where people can recover out loud without shame or stigma in order to make progress. And that is the responsibility of everyone in this room. Do at even one thing we talked about today, whatever you're comfortable with, and we'll get a little bit closer to solving this insurmountable problem. So go out there, create recovery-friendly communities, and save lives. Thank you very much.